All right, guys, it is Asha Creary, and I am back with another episode of Post-Grad with Asha, NCE edition. So for this particular section of the NCE, we are going to talk about section number 4. We're not going to talk about the exam itself just yet, or sample questions. We're just going to talk about the information that's on the NCE content outline. So section 4 of the NCE is a smaller section of your exam. It's 9% on the exam, and it's about 14 questions. So when we talk about treatment planning with this particular exam, we want to think about how are we treating the client? What plans are we putting in place? Are we using appropriate treatment plans? And, are we reassessing and making sure that the treatment plans make the most sense? So section 4 of the NCE, again, is called treatment planning. It is 9% of your test. It's 14 questions, and it is going to be on your knowledge, skills, and abilities to develop effective course treatment. All right, so let's get into it. So in this section, one of the first things that it talks about is being able to collaborate with clients and establish treatment goals and objectives. So when you're working with clients, it looks like the therapist discussing SMART goals, which are specific to their symptoms, which are measurable, they're attainable, they're realistic, and they're specific. What are your clients willing to do to help alleviate the dysregulation they're experiencing? What are they capable of doing that align with these goals or that align with the treatment of what they're receiving? How much time are they willing to commit or implement this? And how much time is needed to see how it impacts your client? And then, are they specific overall objectives? Are they specific to what your clients are working on? So when you're thinking about the NCE, you're going to think SMART: specific, measurable, attainable, realistic, time specific, and again, collaborative, together. Can my client do this? Are they willing to do this? Did they agree to doing this? The things. All right. The next one is going to be establishing short and long-term counseling goals consistent with the client's diagnosis. So if you think about SMART goals specific to the client's symptoms, the symptoms must align with the diagnosis. So when you're thinking about when you were in practicum or an internship and when you were doing charting, specific to client's symptoms. So as mentioned in subsection A, which we talked about just a second ago, are the goals specific to their diagnosis and symptoms? If you're working with a client that has depression, are the short-term goals, can they bathe daily? Do they brush their teeth? Do they eat? Do they get out of bed? Your goals may be aligned with that short term. They may not be ready to engage with the community. They may not be ready to go back to work. You might just be working on eating one meal a day, brushing your teeth once a day or once a week or twice a week. Depends on your client. And then also what long-term goals would help reduce their symptomology. For example, if we're going to continue to go with the thought of depression, we might get into talking about the cognitions that trigger depression or the seasons that trigger depression and putting in coping skills, ways to identify how to implement and follow up on boundaries that are leading them to these depressive states. So on your exam, you're going to think about establishing short-term versus long-term goals in regard to a specified diagnosis. Subsection C talks about identifying barriers affecting client goal attainment. So what this means is when you're working with a client, are you able to identify what's keeping them from reaching their therapeutic goals? Is it financial barriers? And is it following up on barriers or other things that are long-term that impact their ability to move forward? Learned helplessness. Would it be a work environment? Would it be their family situation, their living dynamics? Would it be a long-term health condition? What is keeping your client from, one, implementing the goals, but also what's keeping them from maintaining a healthy, established therapeutic progress outside of therapy and within therapy? The next one is going to be identifying strengths that improve the likelihood of goal attainment. So are you aware of your client's strengths that will help lead them to more or a stronger goal attainment? I wouldn't tell a client who's impulsive you're a strong person. So how about you go to the mall and not buy anything to engage with people? I wouldn't use that, especially if I'm working with my client that has impulse control issues. And when they get overwhelmed or when they get anxious or when they get depressed, they go into a spending frenzy. Sending them to the mall to engage with new people, it's not a strength because they're impulsive. It doesn't make sense. Refer to different levels of treatment. So what this means is, what type of setting would your client benefit from? So on your exam, you're going to see questions that talk a little bit about this type of facility versus this type of facility, what type of treatment they're receiving, what type of treatment they're not. So when you're working with a client, you have to determine, do you know when to refer this client out? Which facilities could help them or programs? If outpatient is a great fit for them, do they need intensive outpatient? Do they need biweekly? Can they do private practice? Are they in need of a specialty trained provider who can treat your client? And then is it somebody who needs to be in residential because they have homicidal and suicidal ideation? So if you think about practicum and internship, what levels are used for what, and being aware of that so you know how to apply which levels of treatment or treatment environments work best for your client. Referring to others for concurrent treatment. So if you are working with a client who is struggling with something and they need additional treatment options, it could be referring them to a specialist for further assessment. It could be working with other specialists that support the progress to your client goals. An example would be if you're providing behavioral health supports to someone struggling with autism, you may have to work with an audiologist or an occupational therapist for sensory related issues and consult together as a team to ensure that all programs are making progress. This could also be a situation where, again, you're working with a client who is struggling with trauma and you get somewhere in treatment and realize, hey, this client may benefit from EMDR. Not only are you referring them, but you may be working concurrently with that other clinician because the clinician may only just do the EMDR portion of treatment. And your job is to continue and maintain the implementation, the goals that you guys have set forward. Or again, it could be you doing individual and you referring them out to Alcohol Anonymous or, some of the other group setting programs that's out there. So the next is guide treatment planning. So some clients you may spend years with and they may not know what they're working on. And as a clinician, it is your role to support in the facilitation, to conceptualize what they're working on, what they would like to work towards in the next session, or highlighting things that they need to be working on. So it's your job to kind of guide, hey, I noticed that you're still stuck right here. Are you aware that you're stuck? Let's work through that. Let's get in there and let's do the work that we need to do to get you out of this space. Discuss termination process and issues. There are times when your clients are ready to go, and it is your job to discuss progress and evidence for the need to terminate services. You review the skills that they've mastered and what it would look like to maintain progress made in therapy. Termination may also include transferring a client to someone who has more expertise to work on an underlying problem after you've supported them with the supporting problems. Sometimes this also includes terminating clients who do not wish to be terminated. Now, again, according to the Code of Ethics, you cannot abandon your clients, but there are clients where you're just going to be like, hey, we're just not a good fit. You may like me as a person, but as a clinician, I am ineffective in supporting you, and therefore I have to terminate this relationship. Okay, section I is going to be discussing transitions in group membership. So this will be you discussing how the group will transition, such as from going from teaching to sharing out to processing, or how they will communicate, how the group will be impacted if it's an open group or a closed group, and group members' attendance, and how it will impact the overall group dynamics. So just knowing what the group transitions are and what they look like is going to be very important for the exam. And making sure that you're familiar with the group progress definitions. like the transition definitions. Following up after discharge. Once a client has been discharged, a clinician should send a check-in message or phone call to confirm either that the transition was successful or if there are any additional tools that they need. So we are not case managers, but you have to do a due diligence to make sure that your client is now in a place where they are continuing services if they are transitioned. If they're in a hospital setting, usually there are caseworkers or social workers that do this for you. But if you're in a private practice and you're transitioning a client to a higher level of care or a lower level of care, it is your job to make sure that they are good and to do the final check-in. That's not to say that you have to re-engage in therapeutic counseling or counseling in itself, but it's your job to transition them to wherever they need to go and making sure that they got to where they're going. Now, some clients, they're going to be good. Most clients, or a lot of times you'll just be like, hey, how's this going? Just checking in to make sure you were able to get connected with that provider, whatever. And then other times it could just literally simply just be, letting them know that you're available if they need to circle back. All right. Use assessment instrument results to facilitate client decision-making. So this talks about identifying assessments that support with helping clients in making decisions regarding career changes, determine how the client should shift on what decisions they may need to make in order to overcome their goals or stressors. So if you're doing a depression screener or assessment, you may be identifying how they experience their depression, which symptoms, and it can help them identify how to make better choices in managing their depression when they're not in therapy. As I mentioned before, career changes. If you got a client that's wanting to transition into a new career, it is your job to make sure that you pull the accurate assessments for this particular client and identify what that looks like for your client, and knowing which instruments make the most sense for your client, but also how do I take these results and apply it to help the client in making a healthy decision regarding their care or regarding treatment. Review and revise treatment plans. So as a clinician, it is your job to monitor your client's progress. It's important to review and update your treatment plan and goals. If working with a client struggling with anxiety, if you are working with a client that's struggling with anxiety, they may have mastered reducing or managing intrusive thoughts after 12 weeks of treatment, but they may not have gained control of their somatic symptoms. So what this means is you may go from the treatment plan working on intrusive thoughts to now let's incorporate some mindfulness related activities to co-facilitate or to support with reducing the somatic symptoms that they're experiencing. Maybe panic attacks, maybe tension, maybe stomach aches, whatever it looks like for your client. You just need to make sure that you understand how to pivot and alter and review and revise how the client receives treatment. Okay. The next is engaging clients in the review of progress towards their treatment goals. This is where the clinician takes time to discuss how much progress the client has made in their therapeutic goals. Clinicians should check in and engage the client in conversations around how much progress that they have made in their goals. Now, some clients come in and they're just like, well, I don't know. I don't feel like I'm making any progress. And you just say, hold on, let's take a step back. When you first came to me, these were the symptoms. These are the coping skills that you've been able to consistently implement that has helped in reducing these things. These are new symptoms. Now, these are the symptoms that we still stuck with. And so your job is to, facilitate like, hey, this is where we started. This is where we're at. This is where we're going. Let's reassess, readjust, and correct where we've been stuck at in regard to your client. So on your exam, it may be a case scenario on where you have to identify what that has looked like in working with a client. The next is collaborating with other providers and client support system, documentation and report writing. So clinicians are expected to treat the whole person. So if a clinician, let's say, is working with a physician, a nurse case manager, a CPS conservator, a nutritionist, and a psychiatrist, it may be important to contact them all as these symptoms impact your client's ability to meet goals. So what I mean by that is, yes, we treat the whole person. So although we are in here maybe working on thoughts, behaviors, patterns, fears, anxieties, trauma, they still receive services from other people. And it is our job to coordinate care coordination, making sure that you're checking in with the nutritionist. Hey, I noticed that they're getting slimmer each week that they come in here, have you seen this client since then? These are my concerns. I am going to encourage them to reach out and reschedule, but I just want you to put it on your radar. This is where the client is, and I'm struggling with getting them where they need to be to come see you. And again, that's an example of working with somebody with an eating disorder. But on the exam, there's going to be questions around who do you collaborate with? How do you collaborate with? How do you document collaboration? What is your role in the collaborative piece in working with a whole client? Or even on teams, what it looks like to work in like a mental health hospital where all of you guys do staffing on your cases. Discuss with clients the integration and management of therapeutic progress. So as you should always do for the intake session, be sure to describe the counseling process. That therapy may feel like some sessions they can conquer the world, other sessions they may feel like they are backtracking, and then other times they may just feel like they didn't get anything from the session. The more formal language would be developing the client-clinician relationship, clarifying and assessing the presenting problem or situation, identifying and setting counseling or treatment goals, designing and implementing interventions, and planning termination and follow-up. So it's your job to talk about it, let them know what it looks like, describe what the process and progress is going to look like, and answer any questions they may have. And lastly, in subsection 4, your job is to be able to understand how to educate the client to the value of treatment plan compliance. So if you think about client roles, the client has a role of making sure that they do what they need to do outside of therapy. Clients have roles in the therapeutic process. So this is really what this is hinting towards. This would include research, articles, and describing of positive changes that may occur when they use the treatment plans and goals that they agreed that they would implement in regard to their journey. The client should also understand their role in the therapeutic journey and how following up on the frequency of services, the implementation of sessions, and everything in between is going to support the reduction or shift in a response to their current symptom. So again, for the sake of this particular section, think treatment. How am I treating my client? What is the plan going to look like? Are we on the same page about what is happening in this counseling relationship? What are the counseling process steps? What does that look like? What are some barriers that my client is experiencing in being able to implement these things? And how can I best support my client in working collaboratively with other providers? So that is it for domain number 4, section breakdown. This video is a little bit more quicker than the last video or the last section, domain 3 or section 3 breakdown of the NCE. So again, this is another episode of Post-Grad with Asha, NCE edition, and we talked a little bit about domain 4. Again, I am a licensed professional counselor in the state of Texas and a licensed professional counselor approved supervisor in the state of Missouri. So if you're looking for supervision in Missouri, I am here. Check out your girl. And if you're just a licensed professional counselor in Texas, I do have study groups for the NCE specifically. So just put that out there. See y'all later.